Have you ever wondered how doctors can perform surgery while the patient is awake but without pain? That's the magic of spinal anesthesia. In this video, we will understand spinal anesthesia step by step in simplest way possible. Spinal anesthesia is a type of regional anesthesia where local anesthetic medicine is injected into the cerebrospinal fluid, also called the CSF, inside the subarachnoid space. Check out my other video to understand more about CSF. So, when the drug enters the subarachnoid space, it blocks the nerve signals from traveling to the brain. As a result, the patient feels no pain. The lower part of the body becomes numb and surgery can be done comfortably. Spinal anesthesia is commonly used for cesarean section, lower limb surgeries, urological surgeries, and lower abdominal procedures. Patient can be positioned sitting or lying on the side. The back is bent forward to open the spaces between the vertebrae. Strict sterile precautions are taken to prevent infection. The line joining the two iliac crests crosses the L4 vertebrae or the L4-L5 space. It is called the Taffier's line. The usual site is L3-L4 or L4-L5 space. This is below the spinal cord, making the procedure safer. The spinal needle will pass through skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, epidural space, dura mater, subdural space, arachnoid mater, and then finally reach subarachnoid space. A slight pop may be felt when dura is pierced. When clear CSF appears, it confirms correct placement. The anesthetic drug is finally injected slowly into the CSF. The local anesthetic blocks the nerve conduction. Pain signals from lower body cannot reach the brain, so the patient remains awake but feels no pain. There is sensory block, motor block, and sympathetic block. After spinal anesthesia, legs become warm, then numb, then weak. The level of numbness depends on drug dose, patient position, and baricity of the drug. Baricity is the ratio between the density of local anesthetic to that of CSF. Density of CSF is 1.003 gram per milliliter. Baricity more than 1 is hyperbaric, which means heavier than CSF. That is, it will move downward towards the gravity in the dependent part. Baricity equal to 1 is isobaric, meaning the density is same as CSF. Baricity less than 1 is hypobaric, which means it is lighter than CSF. It rises against the gravity to the non-dependent part. Like every procedure, spinal anesthesia also has complications. They include such as hypotension due to sympathetic blockade, bradycardia, high spinal if block rises too high, some late complications like post-dural puncture headache which happens due to CSF leakage, urinary retention, bacterial meningitis, and backache. Spinal anesthesia should be avoided in patient refusal, infection at injection site, allergic to local anesthetic medicine, raised intracranial pressure, patient in shock. Relative contraindications include coagulopathy, hypovolemia, anatomical deformity. Spinal anesthesia is injection of local anesthetic into CSF. It blocks nerve conduction used mainly for lower body surgeries, and patient stays awake but pain-free. If this video helped you understand spinal anesthesia, please share with your friends. See you in my next class.